So, talk to us about the causes of this chronic rhinosinusitis. And, listeners, it does sound like a mouthful, but just remember that rhino means nose. And so just envision a rhinoceros, and you can see that in your mind to just remember anything, any medical word that has that rhino is something to do with the sinuses and the nasal passages. And so, what are some of the most common causes of chronic rhinosinusitis?
So, and we can even call it CRS for short. and so, and so the causes to CRS are very similar to causes for gut inflammation. So I see this parallel between the gut and the sinuses. So both the gut and the sinuses have a microbiome. So just like in the gut, we can have pathogenic, neutral, and beneficial microbes, same within the sinuses. So we can have dysbiosis in the sinuses as we can in the gut. So that's one of the reasons. The next reason is we can have an altered epithelial barrier. Well, in the gut, we all know, most people listening to this know what leaky gut is, right? That's the cells lining the organ. They should be tight, and they lose their integrity when there's been insults. The reason I'm bringing the gut here, bring up the gut, is because it's something people are very familiar with now, right? And the parallels are uncanny, actually. And so just like pathogenic bacteria and other environmental triggers can insult the gut lining, well, we can have insults to the lining of the sinuses. So those insults could be, and we're going to talk more about this, smoke from fires, environmental toxins, chronic allergies is a big one. So that can disrupt the epithelia of the sinuses. Now, in the sinus epithelium is also a complex there's complex immune pathways in the epithelium of our sinuses. Well, then they can get disrupted. And so that can create inflammation. So also, how can all this happen? How can someone be susceptible to dysbiosis in the sinuses? Or how can they be susceptible to the epithelium disruption? Well, like I talked about the smoke from fires. I talked about environmental toxins and chronic allergies. But also another one of the triggers are infections in the jaw. So this is common. I have patients come in and they're very aware that they have issues in the jaw. They've got pain. So underneath old root canal, where older root canals have been, and underneath where our wisdom teeth have been pulled, often in my patients, there is infection in the jaw. So we can find that infection in the jaw by doing an ICAT, a cone beam scan, to look at slices of the jaw to find that infection. When that's found, I send them to the right oral surgeon. Well, they can see that is greatly impacting the sinuses. And this is something that's more common than people might realize as well.